Good afternoon. Thanks for joining us across the fence. I'm Fran Stoddard. There's one thing we all have in common: we're all getting older. And as Frank Lloyd Wright once noted, the longer I live, the more beautiful life becomes. But also, as we age, we sometimes need help or support. And in Vermont, that help is available through adult day services around the state. To learn more, I am joined by Kristen Bolton and Marion Werner. Kristen is the Assistant Director of Elderly Services Incorporated in Middlebury, and Marion is a participant in the Adult Day program offered by Elderly Services. Welcome to both of you, and thank you so much for being with us.
Thank you.
Thank you for having us, Fran.
Thank you.
Yeah, it's great to have you here. So, Kristen, to get us started, what is an Adult Day Center?
An adult day center is, some people think it's like a nursing home or like assisted living, but it's basically a tool for people to age in place. So you can stay in your home in the evenings or stay with a family member. And it's more like a school where people come for the day. They keep their minds and bodies active. They have the support of a nurse or a counselor. There's fun things to do. There's great food. And it's a community people can be a part of.
Awesome. And one of the offerings at your center is this Adult Day program. It's called Project Independence. Describe the people that you serve.
We serve a really wide range of people. The youngest is in her 40s, and we have a couple of people who are over 100. The bulk of the folks are in their 80s and 70s, and we serve people who are clear-minded and want to get out and just have some social time, and we also serve people who have greater medical needs, and their families need them to be safe during the day and looked after.
Great, and I'm sure they are safe there. And how many adult day programs are there like Project Independence do we have around the state?
We're fortunate to have 11 adult day programs, and in this rural state, it's nice to know that probably within driving distance, there's a place that you or your loved one can go. So here's a list of all of them that we have currently, and there will be a number at the end people can call if you want more information.
Right, terrific. So what does Project Independence, your program, what does it offer?
We offer a home away from home. So we serve both families and the participants who come. Family members get a break, so they can either be in their house or they can go to work. And the person who comes to Project Independence has a community of people. They can play games and cards. There's live entertainment almost every day, whether it's music or some other kind of entertainment. We play games, we cook. So there's a lot of fun activities to do, a great sense of community. We have an RN on staff every day. We can help people with medication, call the doctor if something's going wrong. We prevent ER visits because we have that level of support, and we have social workers as well, just if people need someone to talk to.
Terrific. And so how would you say it's different from getting help at home, in your home?
It's different from being at home because at home you're still by yourself or maybe with one other person. It's fairly isolating, and one of the greatest diseases afflicting older people is isolation and depression. So here people can be in a community setting, and we're actually a much more affordable alternative than if you decide to stay at home and have someone come in and look after you. So you can see our social worker, Eileen. You saw our nurse, Maura, just helping people as they're actually having a good time and getting ready to go to a fun activity or have a meal with their friends.
Great. So it's wonderful that you have nursing there. People can ask questions, but you also, really get to interact. And so Marion, what's your perspective on the difference between being at home and coming to this program?
Staying at home is okay for a while, but it's very boring. Uh, I need people, and I'm getting older all the time, and my friends are dying. So I need friends. Excuse me. And coming to Project, I have met so many friends, new friends, good friends, and I just need it. I worked at Project for several years, and within a couple weeks, they asked me, how do you like this place? And I said, I have met 85 new friends. To me, that's very important. and because of all the people that I know that are no longer here.
Yeah.
It's just a great place.
Well, and Marion, you also, I heard, made a decision to stop driving. And how does that decision impact your daily life?
Very much. I can't go anywhere unless I ask someone to take me. And that is hard, especially when you've been independent. And I live alone. I'll have a cat, but he doesn't do much company. Um, so this way, they come and get me. They pick me up to go to project. I'm there talking, laughing, eating, learning, and they bring me home. And I go twice a week. That's enough for me. And it's just has solved my problem of not being able to drive.
That's wonderful. So Marion, what's your favorite thing to do when you go to Project Independence?
Uh, I like to talk. I
Yeah.
like to laugh. And everywhere I go here, there's people that want to do the same. And it's uplifting. I
Well,
like the meals. I like the programs. Whatever they're doing is good. I walk outside almost a mile when I'm here, and that's good for me. And it's just a wonderful way to get out.
that's terrific. So you can also do outdoor activities, even in the winter.
Yes, yes. We've walked almost every day all winter.
Wow, that's terrific. Um, and so, Kristen, just to get back to you, just talk a little bit more about the key benefits of the adult day programs for both participants and their families.
So the participants, as Marion said, have a day where they get to get out, be with their friends. It's uplifting, it's fun. It's like having an exercise class, going to a concert, going out for lunch, having coffee hour with your friends, and checking in with your counselor or your doctor or nurse. So we package that all up in a bundle. And it alleviates isolation and depression, which is really devastating. We have a lot of fun here. For families, they can rest easy. They can be at work. They can be taking care of some things at home. And everyone wants to age in place. No one wants to go to a nursing home. No one wants to go to a facility that's more institutional. But it's a lot of work for families to keep a loved one at home, but we make it possible to achieve that.
And it sounds like, Marion, you said 2 days is fine. You can go for 1, 2, 3, 4, or 5 days. Is that right?
Yes, yes, yes. And some
Terrific.
people do.
Yeah. Some people go all 5 days.
I think so, yes.
So you were talking about cost. How much does it cost, and how are these services paid for, Kristen?
It costs $19 an hour, and we have social workers who can help families figure out how to pay for it. In contrast to other services like a home health agency coming in for caregiver respite and support, it's actually quite affordable. And some people say, wow, this is a lot more reasonable. And plus, my loved one gets to get out and have a lot of fun. So there are programs for people on middle incomes, and also Medicaid supports our program. The VA supports our program. So there's a lot of ways to get funding to support the program. And we have staff able to help people identify that funding.
Terrific. And clearly it creates so much support because you have all these people that are there. Yeah, we discussed the benefits of the adult day programs for the participants and the families. Do you also give help or support to family caregivers?
We do, and that's a really important part of our mission. We don't see the older person who comes in isolation. Some people like Marion are very independent, and they don't need as much support. Their families don't need as much support. But say something were to happen and Marion's health were to decline, we would be right there on the phone with her family, helping them figure out what are the next steps. For caregivers taking care of someone with dementia, we have caregiver support groups twice a month. We offer individual counseling. We just want to provide wraparound services for them.
So Marion, what would you say to some people that might be hesitant to go to a program like this? They're sitting at home, they're watching us, and they're like, well, I don't know. How would you encourage them to join and try out what you're doing?
I tell them how much I like it And then I say, try it. Come for a day. See what it's like. Try it for a week. And I have done this with several people and they're coming. You had, granted, there are a few people that will say no, but most people just want to be encouraged. I talked to someone the other day and she said, I'm not a people person. Well, that doesn't matter. She can become one. She needs to get out. That's what I've heard. So I really talk it up every chance I get.
Well, that's wonderful. So even if she feels she's not a people person, just being among people,
Yeah,
I
yeah,
can imagine is just so healthy for us as we get older.
it is.
So, Kristen, how can viewers learn more about your services?
Believe you'll be listing the senior helpline for this is our line. If you want to call elderly services and speak with me, I'm happy to talk to anyone around the state and have you find direction. There's also a senior helpline offered through the Agency on Aging that's very, very helpful if you have anything on your mind about growing older, whether it's funding or meals or where's the adult daycare closer to me. Please call this number. They provide outstanding help. So as Marion said, don't just sit alone at home and think you don't want to be around people. It's a real pleasure to be with people, and you can find ways of getting just enough people time to lift your spirits.
Absolutely. It's so good for all of us to be with people, and certainly as we get older. That number again for the Vermont Senior Helpline is 1-800-642-5119. That's the number to find out where a place near you might be. Kristen and Marion, thank you so much for joining us today and talking about these adult day programs. Really terrific.
Thank you so much for having us, Fran.
Thank you.
Thank you,
Thank
Marion.
you.
And thank you once again for joining us across the fence. I'm Fran Stoddard. Stay well. There, let me say, there they are. Well, that was terrific. Do you guys feel good about it? You were both great, Kristen and Marion. Thank you so much.
Well, thank you, Fran, and thanks for picking up where I didn't hand off to Marion the way I should have. I didn't want to be looking at my paper because I thought that would look strange on television. So I
think it all worked fine. I thought, that's a great thing if it happens, and if it doesn't happen,